Okay, hello everyone. I'm Amber.
Joanne, and we're presenting on stroke education.
Okay, so these are the topics we're going to cover in our presentation. We're going to be talking about what stroke is, some of the signs and symptoms that are experienced when you have a stroke, deficits, risk factors, lifestyle changes, and rehabilitation after a stroke. So stroke is also known as a cerebrovascular incident or brain attack. And a stroke happens almost every 45 seconds. It's the fifth leading cause of death after heart disease, cancer, unincidental injuries, and respiratory disease. And stroke is non-discriminatory. You can have it can happen to anyone, it can happen at any age. So stroke occurs when blood flow to the brain is disrupted and the brain is starved for oxygen. And if a stroke runs its complete course of about 10 hours, the brain loses a lot of connections, as you can see here. The most common types of stroke we're going to talk about are going to be hemorrhagic, ischemic, and TIA, which is transient ischemic attack. So the common types of stroke, starting with hemorrhagic, that's going to be the bleed. So this is when a weak blood vessel ruptures and it causes a bleed in the brain. Blood will accumulate and affect surrounding brain tissue. And the two types of hemorrhagic strokes are aneurysms, or they can result from aneurysms or AVMs. Aneurysms, the most common. That's when there's a ballooning of weakened region of a blood vessel. And if left untreated, the aneurysm continues to weaken until it ruptures and bleeds into the brain. Some causes for this can be high blood pressure, blood thinners, and typically it develops around 40 years of age if you have an aneurysm. And ischemic, that's going to be a clot. This accounts for the majority of strokes, about 87%. This is when fatty deposits collect in blood vessels, causing a clot. And they can occur within the brain or travel to the brain from other parts of the body. And common treatment for this is the TPA drug, which dissolves the clot. This is if you're within a certain window, you can receive this clot busting drug, and it can help kind of eliminate some of the deficits that you may experience from having the stroke. There's other ways that they can also remove the clot if TPA is not warranted. And the last is going to be TIA. That's a mini stroke. So this can signal that a full-blown stroke is ahead. So it's kind of like a warning sign. It doesn't cause any lasting damage because it travels so fast. And a third of the people who have a TIA will have a stroke within 1 year. So it's just, like I said, a warning sign. This is a little graphic to show you the different types of strokes like I just went over. Ischemic is going to be the clot. Hemorrhagic is going to be that bleed. And then transient ischemic attack, that is going to be a temporary blockage of blood flow. Okay, so this, the signs and symptoms of a stroke. So the American Heart Association has this acronym, Be Fast, and this is a way that you can identify if you or someone else is having a stroke. So the gist of this, you're going to have some sudden changes like numbness or weakness in the face, especially on one side. You could have sudden confusion, trouble with speech and understanding, even visual changes, trouble walking, dizziness, incoordination, and maybe even a sudden severe headache of unknown cause. So the acronym Be Fast kind of combines all those symptoms into one. It covers balance, eyes, face, arms, speech, and time. Time being, if you see any of these symptoms, you need to call 911 right away so that person can get medical treatment. Okay, deficits after a stroke. So, the diagnosis of a stroke is going to depend on the type and the location. So, imaging is usually done first thing when a person arrives to the hospital with a stroke. Either a CT scan or an MRI is the most common. And then professionals will come in and assess different areas, like speech pathology will assess some of the cognition and changes in the brain. So the location. So strokes can happen in our left hemisphere, right hemisphere, and sometimes both. Um, Left hemisphere is more known for our speech and language centers, and the right hemisphere is more for cognition and some more artistic abilities. And so, with a left hemisphere stroke, there could be deficits like aphasia, apraxia of speech, paraphasias, word finding difficulties, and weakness and paralysis on the right side. For right hemisphere strokes, deficits could be unilateral left neglect, visual neglect, construction difficulties, dressing difficulties, and denial or indifference. And so damage to either lobe is going to affect the opposite side of the body when it comes to weakness or paralysis. And effects can cause physical, sensory, perceptual, cognition, and or psychosocial changes depending on the location. So physical is going to be kind of that weakness and paralysis in the arm, legs or face, can control balance, coordination, swallowing. Sensory is going to be our senses. Cognitive changes like inattention, disorientation, memory loss, impaired insight and judgment. Perceptuals like our proprioception, where our body is in space, and psychosocial will be some of those more personality changes, grief, disinterest, lack of motivation. And then it's important to note that changes to the cerebellum and brainstem, those are really important for life-sustaining functions. The cerebellum is going to be for your posture, your movement and coordination, your ability to walk. And the brainstem is really important for sleep, heart rate, temperature regulation, respiration, and also swallowing. This is just like an overview kind of all the skills and functions within the lobes of the brain. So if you, for example, were to have a stroke affecting the frontal or parietal regions, these would be some of the skills that may be affected, some of the skills and functions that may be affected. And then this image is just showing what skills we have that are controlled by the right and the left side of our brain. So as you can see, the left is analytical, more about thought, rational thoughts, and right-sided motor skills, whereas the right side is more intuitive, more holistic perceptions, and left-sided motor control on that side.
All right, so now we're going to talk about some stroke risk factors. Risk factors that you can't control would be age. The likelihood increases with age for both men and women, more common among the elderly, but a lot of people under 65 also have strokes, even babies and children. So family history, if your parent, grandparent, sister, or brother has had a stroke, especially before reaching 65, you may be at a greater risk for getting a stroke. Race, African Americans have a much higher risk of death from a stroke than Caucasians do. This is partly because they have higher risk for high blood pressure, diabetes, and obesity. Gender, women have more strokes than men, and strokes kill more women than men. This is because women tend to live longer than men and are older when they have a stroke. A prior stroke, TIA, or heart attack, a person who has had prior stroke has a much higher risk of having another stroke than a person who has never had one. A person who's had one or more TIAs is almost 10 times more likely to have a stroke than someone of the same age and sex who hasn't. Risk factors that you can control, high blood pressure or hypertension is a leading cause of stroke and the most significant controllable risk factor. Smoking, the nicotine and carbon monoxide in cigarette smoke damages the cardiovascular system and paves the way for a stroke. This combined with taking birth controls can greatly increase a risk of stroke. Diabetes, if you have type 1 or type 2, you would need to control your blood sugar. Many people with diabetes also have high blood pressure, high blood cholesterol, and are overweight. This increases their risk even more. While diabetes is treatable, the presence of the disease still increases your risk of getting a stroke. Diet, diets high in saturated fat, trans fat, and cholesterol can raise blood cholesterol levels. Diets that are high in sodium can increase blood pressure. Diets with high calories can lead to obesity. So it's recommended to have a diet containing 5 or more servings of fruit and vegetables per day to reduce the risk of stroke. Physical inactivity can increase your risk of stroke, heart disease, obesity, high blood pressure, high blood cholesterol, and diabetes. It's recommended to be active at least 150 minutes a week. Obesity or excessive body weight are linked with an increased risk of high blood pressure, diabetes, heart disease, and stroke. And lastly, high blood cholesterol. Large amounts of cholesterol in the blood can build up and cause blood clots, leading to stroke. So this is just a checklist of things that you can do to prevent another stroke from happening. So things that are recommended to do after having a stroke to prevent another one would be first to maintain a heart healthy diet, eat at least 14 grams of fiber daily for every 1,000 calories consumed, keep cholesterol down to 300 milligrams a day, don't smoke or vape, maintain a healthy weight, having a waist measurement of 35 inches or more for women or 40 inches or more for men. Raises the risk for diabetes. Exercise every day, limit alcohol consumption, and learn to manage stress. So for rehabilitation, we're going to talk about things to do after you have a stroke. So there are a lot of rehab programs, and it just depends on how the stroke affected you and what kind of stroke you've had. But the programs include rehabilitation nursing, physical therapy, occupational therapy, speech therapy, audiology, recreational therapy, nutritional care, counseling, social work, psychiatry or psychology or patient, family education, and support groups. So rehab should include training to improve mobility, ability to do daily tasks, tailored post-stroke exercise programs, access to cognitive engagement activities such as reading books and playing games, speech therapy if stroke caused difficulty speaking or swallowing. Speech therapy could also include working on social skills and interacting with people, or cognitive skills such as memory or problem solving. Eye exercises if stroke caused loss of vision, balance training for those with poor balance or a risk for falls, adaptive strategies to help you function within a new normal. All right, and then the last slide is just our references.
And if it'll pop up, there we go. Thanks for listening.